for Monday, February 8th at 4:30 to order. Amy, can you call the roll, please?
Danielle Chenoweth,
Present.
Andy Kornstrom,
Present.
Darlene Kleppel.
You're on mute. She's present.
I read her lips.
Okay.
Okay, we have all board members present. I would entertain a motion to approve the agenda.
So moved.
Second.
We have a motion, a second, any discussion? If not, roll call, please.
Danielle Chenoweth,
Yes.
Andy Kornstrom,
Yes.
Darlene Kleppel.
Is that a yes, Darlene?
Yes,
Okay.
I'm sorry.
Good. I think if you hold down the space key, you can also just say yes and then go back to mute. It's one option if you want to go back and forth.
I think I'm just not speaking right into my computer too
Oh,
loud.
okay. Yeah. Let's see. I would entertain approval of minutes of previous meetings, January 11th, 2021, monthly meeting.
So moved, and I didn't know the space bar thing. This is awesome.
Okay, second. I second it since I was at that meeting. Any discussion or changes? If not, could I have a roll call, please?
Danielle Chenoweth,
Yes.
Andy Kornstrom,
Yes.
Darlene Kleppel.
Okay, next we have public participation. I am looking, I see a telephone number. Otherwise, I think it's staff and board members. Is there anyone who would like to speak to the public, please? Going once, going twice? Okay.
This is Jim at that telephone number, probably.
Oh, Jim, that's you. I should know by now. Okay. Public participation, I'll go ahead and close that. Correspondence, Julie, do you have any items from the officers?
No, I actually just got an email that I thought was interesting from Channel 3 that told me that the social media companies are going to work to start getting this crazy misinformation about vaccines off of the internet, thankfully. And because, as you know, we have people who apparently just sit around and wait for us to post something and then post crazy misinformation, all kinds of wild stuff on there, and some of it's dangerous. So that'll be nice. And also, apparently, there's money in there that we can apply for to get free ads for our information. So we'll figure out how to do that. Correspondence-wise, boy, it seems, I don't know, anybody help me out? Oasis or anything else? I mean, I can't think of anything right now.
Yeah, the only thing that I can mention is that the B117 strain is in our community, and we have multiple cases confirmed at the U of I in-house sequencing that it is here. So we are working on a campaign to educate the community about what it means once we have that in our community, and that is why masking and social distancing continues to be important. And although the vaccine, we know both the Moderna and Pfizer are pretty effective against the B11 strain, but this is only one of the multiple strains that are circulating in the US, and the others are expected to be in our community pretty soon as well.
I regularly get questions about vaccines, and I send them to the vaccine page on CU Public Health. It's my understanding that essentially there's a category, what is it, 1B, that's open now, and that people can call and await a callback. They can call and try to get through, or they can sign up for a callback. Is that correct information? Is there anything else we need to know about vaccine access?
Yeah. It's the vaccine thing, you know, every week it's going to be different, but right now, Awais, do you have the list in front of you of where we're doing vaccines this week? That might be helpful, but every week it's going to change. Yes, the Dress Barn location this week is going to be doing, several thousand, and that is going to be for people in 1A or 1B who haven't been vaccinated yet. We have a catch-up clinic here as well. We also have, I don't know, we don't really have a name for it, but if people need extra assistance with their vaccine, either because of, they're deaf or hard hearing, or if they are, if they don't speak English, or if they have cognitive issues, or if they are nervous about going someplace else because of immigration status, any number of things. We have clinics here that we can get people in for if they've missed it, missed a previous clinic, or they're not comfortable with another clinic. So we do have that. And then Oasis, if you want to read that, otherwise I can pull it up.
Yeah, I mean, the car location this week is doing about 5,000 vaccines. CUPHD in-house will do about 1,000. The iHotel Conference Center will do about 3,000. And the OSF in Rantoul is going to do about 1,200 vaccines this week itself. And then coming back to Danielle, your point that yes, you can call or you can sign up. And Carl has confirmed this morning that they are responding to those within 30 minutes. So everybody that signs up is getting a response back within about 30 minutes. And there are thousands of appointments available for this week.
And I can go over real quick who is in 1B right now. So anyone 65 and older in our county is eligible to be vaccinated. So they can either go through that site or, contact us. But also first responders, we believe that they're all vaccinated, but if somebody missed it, they're eligible. That's firefighters, including volunteers, law enforcement officers, 911 dispatch, public safety answering point, whatever that is, security personnel, school officers, EMS personnel, corrections officers, and inmates. And we have offered it to the people in the jail officers, juvenile facility staff, workers providing in-person support, and inmates. Food and agricultural workers, this is people working in processing in the plants, veterinary health, livestock services, and animal care. Postal service workers, manufacturing, and this is the big one. And Oasis and I just got off a call with the manufacturing group. That is, manufacturing workers or industrial production of goods for distribution to retail, wholesale, or other manufacturers. Grocery store workers, which include baggers, cashiers, stockers, pickup, and customer service. Public transit workers, flight crew, bus drivers, train conductors, taxi drivers, paratransit drivers, in-person support, and all of the ride sharing services. And God knows we have a ton of those in this community. Education workers, we believe that those are either all vaccinated or in the process of being vaccinated because of the gigantic Unit 4, Champaign Unit 4 vaccination clinic this week, and 116. They both vaccinated all of their employees that were interested. And then also we're working this week with the shelters, adult daycare, homeless shelters, women's shelters, adult day drop-in program, sheltered workshops, and psychosocial rehab. Those are all also eligible. And that's it. But and with that said, that is a ton of people. So just to real quick give you where we are with vaccination, we have, as of yesterday, 41,395 people with the first dose, 7,690 with the second dose. That's 4.45% of our county. And the waste figures, there's probably also around maybe 10,000 people that we have vaccinated in our county who live in other counties. So you'll notice the counties around us are starting to show that they're getting a lot more vaccinated. And those are people who work in our county but live in their county, therefore they're counted in their county. Also, we currently have 710 cases, 917 in quarantine. It's a 4.0% positivity rate. We have 24 county residents hospitalized and 112 deaths.
Thank you, Julie. Any questions from board members?
Madam Chair, I'd just like to note it, and I'm sure we've all seen it on social media, but public health really should be applauded for just all the good work they're doing to get the vaccines out. I mean, the politeness, the timeliness. I know everybody wants one, but thank you guys for leading in this and for making us look good, because I mean, you guys just you're killing it. So thank you very much. So
Thanks.
Ditto.
It's a big group. It's,
Mhm.
but we're moving through it, and we always knew we would. But they're, all the different sites are just cranking through this vaccine. So the more people can help us get the right people to the sites, the better. And just so you know, we are working on all kinds of things to make sure that we have equitable distribution as well. So that's the stuff you don't see that's going on behind the scenes, but it's going on, and we have lots and lots of people helping us with that as well.
Great, thank you so much.
Mhm.
Moving on to old business, we have none. New business, treasurer's report. Ron? Is Ron here?
I don't see Ron.
I don't see Ron, actually. Did Ron?
No, actually, Ron's not here. For those of you that don't know, he had an accident or whatever, and I don't know what happened, but he fell and broke his elbow last week,
Hmm,
and he had surgery. So he
Oh.
asked me to step in for this part.
Okay, thanks, Mandy.
I'm not going to read it all to you, but the cash at the end of December is 1.5 million, and that's at 29% of our annual budgeted expenditures. So we're above on that. And the income statement says we're under budget by 1.3 million. And expenditures are under budget by 2.1 million. Most of that is, like always, the personnel and benefits. So, any questions?
Any questions from board members? Okay, I would entertain a motion to put the treasurer's report on file. I saw your lips move, Darlene, but I think she's just hold down the space key.
I'll second it.
Okay, so a motion from Darlene, a second from Andy. Any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Okay, that's approved. Thank you. Next, I'll entertain a motion of approval of payments to the Board of Health appointees to Treasurer Ron Fields in the amount of $630 and to Attorney Ruth Wyman in the amount of $13,925.
So moved.
Second,
I have a motion and a second. Any discussion or questions? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
That motion carries. Next, we have a review of the monthly credit card statements, pages 12 to 20. Any questions about the credit card statements? If not, I'd entertain a motion to put it on file.
So moved.
I'll second.
Motion and second. Any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
We have ratification of police service estimate from the city of Champaign in the amount of $9,935.91. I'd entertain a motion.
So moved.
Second,
And just to clarify, this a ratification. It was brought to me last week or the week before to confirm. Any issues with the security? Okay. Then is there any discussion? Okay, roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
She said yes, it's just soft.
Okay, approval of, next we'll have approval of the commercial lease agreement between the McKinley Foundation at the University of Illinois and CUPHD for building space located at 809 South 5th Street in Champaign for the time period of January 1st to December 31st, 2021, in the amount of $206 per month or $24.72 per year. That's $2,472 per year. I'd entertain a motion.
so moved.
Second.
Do I have a motion and a second? Any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornston,
Yes.
Darlene Kleppel.
Yes.
Next, we have approval of Comfort Suites invoice in the amount of $29,122.91. I'd entertain a motion.
So moved.
Second.
We have a motion and a second. Any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornston,
Yes.
Darlene Kleppel.
Yes.
Next, we have discussion of the fine structure for non-compliant food establishments. Is this Ruth Wyman? Or is this Jim, or both of you?
Jim, how do you want to do this? I'm sorry, I didn't talk with you beforehand to see how you wanted to structure this.
Yeah, Ruth, I think you could take the lead. I really don't have any knowledge of what you propose.
Okay, so just to talk a little bit about this, there had been some discussions at an earlier meeting a month or two ago about these concerns about with the restaurants, and so the fact that when the restaurants were not in compliance and public health went after them, obviously expending a lot of money and resources to actually hold them accountable. There was a lot of concern about the fact that there wasn't a lot of financial disincentive for the entities to simply comply because just because of how the structure was. And so we talked about, and it was brought up should we start to implement like a fine structure for the non-compliant food establishments. And Darlene, you may be aware of this from sort of the county perspective. I believe that the county does have a fine structure, but in Champaign and Urbana, there's not really a fine structure, and it's a little bit different as well because we work with or we have the licenses are with the cities of Champaign and Urbana, and so there's work with the two cities, but the cities have some fines, but it appears that the cities can sort of decide whether they wish to enforce the fines or not. And so we saw that in, for example, with Mary Ann's Diner, where the city of Champaign elected to simply gain compliance. Their goal was compliance, as opposed to sort of penalizing or making sure that that entity realized that it would not be financially advantageous to just prolong and delay compliance. And so with that, I suppose that's sort of the impetus for this, if we want to start to look at what the county does and sort of mimic that, or if we want to look at some different ideas or potential structures.
So thank you, Ruth. I think what we're looking for is direction for legal counsel on next steps. And to put it very briefly, Darlene, we had food establishments that remained open for 2 months that have not been fined and had no consequences. Mary Ann's Diner on Neal Street is the most noteworthy of those. And so essentially other establishments were shut down. They did not comply, and City of Champaign did not enforce any fines or fees, nor did the county, as far as I understand. So we discussed that we are lacking enforcement as CU Public Health in this area. And I made a recommendation that we establish a fee structure for non-compliant food establishments. Pandemic is not over, and also this will, we may see something like this again. And clearly this revealed that we have a gap in services. So I think what my understanding, and we could, we can clarify this, is that if there appeared to be unanimous consent for us to move forward with a fine structure, and if that is still the case, then I think I would expect that we would have some documentation in writing at our next meeting that we would be able to review and vote on. If that's not the will of this board, then, please speak up. Go ahead, Darlene.
I would be in agreement if we're going to have an ordinance and we want to have teeth in it, we have to have something to put teeth in it. Obviously, Julie and I have talked about this many times. The first goal would be education and trying to get voluntary compliance, but there's always going to be one or two people that are not going to do that. They just have to push the limit. And so you do have to have something to put teeth into it. Whether we choose to enforce that when the time comes, if we can get them to comply without it, that would be our choice, but I think it should be there. So I would agree with that.
Jim, did
This
you have
is Jim-
something you
this is
wanted to
Jim.
add? And then Ruthie
Yeah,
next.
I think that we should maybe consider expanding it beyond non-food establishments as well, because we have a ordinance for face coverings and gathering size that's in effect right now. And I have places that are going to get to the point where we go through the 3 steps that we have, and that, maybe we should, again, look at expanding the fine structure to these other establishments.
The places that are not enforcing face covering.
That's correct.
Okay. Ruth, you had something, and then I'll take Stack. So if you want to speak, just raise your hand.
Sure. So one of the questions, and maybe I can prepare it both ways, but if Ms. Kleppel had talked about or mentioned, if we have these, then in the end, it can be the decision about whether to enforce the fine, or maybe it was whether to charge the fine or not. And we can have it, I can prepare or draft something that includes where it's the staff, or maybe you'd want it the board that decides whether to enforce the fines, or have it that it is a required fine. That is, that there's no sort of discretion by whoever's enforcing, whether it's, I guess it would be the staff to enforce it. What we see, or what I saw in the city of Champaign with the Mary Ann's Diner, is that while the ordinance has, I think it was a $500 a day fine, the staff apparently has discretion on whether or not to enforce it. And so it appears to sort of have been the city of Champaign's policy to simply not charge the entities. And I see that in landlord-tenant cases with building code violations. The question is, I guess the question, or something that you all should think about, is if you want to leave it for the discretion of staff, or have it as a non-discretionary, this is what it is, mandatory. Doesn't matter what your excuse is, or whatever, however sympathetic your issue is, or if you want to make it a discretionary, and just thinking about it that way. And so if you guys want to contact me by email or call to discuss, I'm happy to do that. Or if you want me to look at sort of preparing it both ways, and then you all can discuss it. But that might be one thing to think about, because in the city of Champaign, where it is just appears to be a discretionary thing, that's how Mary Ann's followed it. Is they didn't have to pay anything.
Okay, Andy.
Thank you. I'll try to speak to a few of the points. So I think removing discretion is the best policy. I don't want to put an employee into a position where they are getting talked into or out of anything. I think an educational component as the first interaction, and followed by a fine without question, is appropriate. That's just my opinion. To Jim's point about the face coverings, do we actually have jurisdiction if it's not a licensed facility under public health? Do we have jurisdiction when it comes to enacting fines? Let's say there's 30 people in a grade school gym that doesn't have a kitchen, or whatever number we want to use, and they're not using either social distancing or masks. Do we actually have jurisdiction to fine them if they don't have a restaurant?
Well, all I know is the way we wrote the ordinance on face coverings, it said any businesses and individuals. And so I would think our ordinance would cover businesses and individuals within the jurisdiction of the CUPHD.
Okay.
Okay, it sounds like I would just +1 on education and voluntary compliance first. I hear unanimous support for that as part of the resolution. The second would be followed by a fine. I'm also hearing unanimous support for some kind of fine structure. I think last time we spoke, we talked about an escalating fine. So actually that it's time-based. So that it becomes more painful over time to continue to not be in compliance. And in particular, Darlene, just to bring you up to speed, last time we spoke, the concern was that basically it's an economic choice. Like, if you're making X number of dollars a day and the fine is Y dollars, you just trade off and decide, is it worth it? So the escalation of fines seemed to me with that concern. I think the third issue with regard to food establishments and should it cover face coverings, I think I would suggest that the jurisdiction question is important. And that if it's going to include face coverings, that we ask whether we have jurisdiction over establishments, any kind of organization or business or entity, and whether we have jurisdiction over individuals. We don't really have an enforcement mechanism for individuals. So I find that area to be much more difficult I guess I would say, I would recommend that we not attempt to have jurisdiction over individuals, because I don't think we have the mechanisms in place as public health to enforce that. But I do think it would be appropriate to enforce it on the level of businesses and other establishments that may not be complying after, again, education and voluntary compliance techniques are used first in every case. Ruth, you have a hand up?
Yeah. So I think the idea of keeping it at the businesses and not individuals would be consistent also with what you have as requirements on the restaurants as well. It's, I believe the fines are on the restaurant or on, as opposed to a customer who's not complying. So I think we would keep it that way. That makes sense to do that.
Okay. Julie, did you have a hand up? You're on mute.
My space bar didn't work. I was just going to say that we have something already in place for the smoking program, and we've used that, in the past, and it has escalating fines, and there's so if you want to look at that, maybe Ruth, that would probably be helpful.
Great. Okay, so I guess I will maybe make a motion so that it's clear that the motion is to direct our legal counsel to draft a fee structure for non-compliant establishments, both with pandemic response as well as mask wearing, where the fee structure has education and voluntary compliance first, followed by a fine that escalates with time, and that it not cover individuals, but only organizations and businesses and establishments.
Second.
That's my motion. And there's a second from Andy. Any discussion on that? Okay. If not, if we could have a roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Okay, great. Thank you, Ruth, for working on this. Appreciate it. Next, we have a discussion regarding construction contracts and the selection of contractors. Who is the staff person who's going to speak to this?
That was actually me that requested this to be on the agenda, if I
Okay,
if
go
I
ahead,
may.
Andy.
So I was hoping that we could have a brief discussion and maybe provide some direction. Obviously, we pay prevailing wage for all of our contractors. What I was hoping we could see done is a preferred list, and so that effectively contractors would be union contractors first, and then if either they aren't interested in the job or we can't get a hold of them or whatever, we would then go to other contractors. And I assume that it's legal to do something like that, to have a preferred contractor list that meets certain requirements. But I think that that would be an important step as we, have contractors in the building quite regularly. And so I'll guess Ruth might be able to comment on it, or HR, but that was my thought.
Okay. Ruth, you're welcome to comment. And I also have a comment, so go ahead.
Sure, I don't anticipate a problem with this. I know that the cities of Bloomington and Normal, as municipalities, have prevailing wage requirements. And so that was something that was attempted by Urbana City Council in late 90s, I think, but failed. But I don't see a problem with that. Andy, if you have sort of an entity that where you've heard from this and they're doing it, or that sort of thing, or where that idea is from, I can follow up just to make sure. That's probably what would be the easiest way, just to make sure everything is sort of consistent. And if they're relying on certain statutory requirements, we can, it's easy to sort of start from there and then move forward.
Understood.
Darlene, and I'll put myself in stack. Go ahead, Darlene.
So what I would like to say is that the city of Champaign has started a program that the county is also interested in, that does try to provide preference to minority contractors in particular, but also union contractors and local people. So there's different categories. So local, union, minority, there's different categories. You can do it in a way that scores your applicants so that you give preference to those, but you do have to be a little bit careful how you do that. Because if you're working with government money, almost always you need to go with lowest bidder. So there are ways of doing that. I would suggest that you talk with Rachel over at Rachel Joy at the city of Champaign, who's been working on this for quite a while. And I know the city of Urbana has worked with her, and I know I've spoken with her, so she probably has the most information that would help you get started on that.
Thank you, Darlene. Yeah, I would just say I would prefer to see something that it's a point preference system that includes minority and local businesses. And that there's an excellent report, which I'm happy to share with you, about minority representation in the trade unions. I know that the unions have really been working on this issue, and there's still room for them to improve. And I think it'll be important to encourage. I know at the Housing Authority, we have done a lot to engage with minority-owned businesses in terms of our business development. And this is after years of being told, when I was on the city council, which was some time ago, that there simply aren't contractors in town that are minority-owned contractors. And I think the Housing Authority has really proven that to be untrue. And so I would encourage us to look, I guess I kind of agree with you, Darlene, in terms of the broader picture. And I, do agree, Andy, if there's a way to give a point system that includes union labor, I would support that. Is it the case that we are required, as you said, Andy, to pay prevailing wage?
It's my understanding.
District level?
Yeah, I think we are.
Okay.
And I too would be supportive of a point system, and I, those three categories of local, minority, and union, mimicked off of what the city has done. I would be supportive of that as well.
Okay. Well, you all are very easy this evening. This afternoon, we have consensus on a number of issues. It sounds like a next step would be to speak with the city of Champaign and not necessarily retrace steps. And so I guess instead of, I don't know if you want to put a motion on the table, or if we should simply, it seems a little early for that. Maybe perhaps we can ask Julie to direct the appropriate staff. And if you need to bring legal counsel into that, but it sounds like perhaps a staff assignment that you'll need to squeeze into busy schedules and bring back to the board. Do you have an expectation, Andy, of when you'd like to see this back again?
No, I mean, I we're in the middle of a pandemic, so I don't want to kill anybody, but just whenever staff can get to it would be fine with me.
Okay. Great. Okay, thank you for bringing this forward, Andy. So that was a discussion only. Next up, we have this is number 9. I'd entertain a motion for the United Way of Champaign County requisition 676 for county subrecipient services in December 2020 in the amount of $63,640.
So moved.
Second.
Do you have a motion, a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes,
Andy Cornstrom,
Yes.
Darlene Kleppel.
that passes, and I should have taken this as an omnibus. Let me do the next 2 as omnibus. I would take 11 and 12 together. United Way of Champaign County requisition 675 for district subrecipient services in December 2020 in the amount of $63,640, and also United Way of Champaign County requisition number 750 for 2021 membership dues in the amount of $5,000. I'd take that as an omnibus motion.
So moved.
Do you have a motion and a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes,
Andy Cornstrom,
Yes.
Darlene Kleppel.
that passes. Next, we have number 12, approval of 8655 reporting agent authorization form. I would entertain a motion.
So moved.
Second.
We have a motion and a second. Is there any further discussion? Roll call, please.
Danielle Chenoweth,
Yes,
Andy Cornstrom,
Yes.
Darlene Kleppel.
next meeting is scheduled as a study session on February 24th, 2021 at 10:30 a.m. Darlene, I would just give you a heads up that we oftentimes cancel our study sessions unless they have an agenda item. So you will hear from us if it's going to happen. And then our next monthly board meeting is March 8th, 2021 at 4:30 p.m. Is there any other announcements or business before the board? If not, we stand adjourned.
Thank you.
Thank you.
Thank you, everyone.